we are talking about the phenomena of the world of cosmetic surgery. What's hot, what's not? Who is getting what? The global spending on cosmetic procedures is currently estimated on $20 billion a year, and it's set to increase to $27 billion in 2019. In Australia, 30,000 liposuction and 8,000 breast augmentations are performed, with about $1 billion being spent on cosmetic surgery. Today I'm speaking to Dr Ehsan Jadoon, a prominent cosmetic physician based in Perth, Australia, who is featured regularly in the media. He specializes in facial makeovers and body sculpting. He also travels to rural areas to perform on patients. Hello Ehsan, and thank you so much for being on Hello Darlink.
Thank you, Barbara. Welcome to the clinic.
What is the biggest misconception today if it comes to cosmetic treatments, cosmetic surgeries?
We find that a lot of people associate cosmetic medicine and surgery often with hospitalized procedures where a lot of surgery under general anesthesia is done, and it's a lot of cutting and bleeding and long recovery times. But that is not the case. The current trends in cosmetic medicine and surgery are about minimally invasive procedures, walk-in, walk-out or lunchtime procedures, and with very little downtime, and they're relatively more affordable.
Wow, fantastic.
Thank
so
you.
Someone can go in a lunch break and have something done.
Absolutely, absolutely. There are lunchtime procedures that we offer and other clinics offer as well that just involve maybe somewhere from 10 minutes of your time to half an hour of your time.
Incredible. Now, tell us about the most popular treatments.
Look, for our practice, anti-wrinkle injections, dermal fillers, skin rejuvenations are always the most popular treatments, but we also offer relatively newer treatments that have come in the market. CoolSculpting or freezing the fat is one of them.
Freezing the fat? How
Yeah.
does it work?
Okay, so excess fat deposits in the body, traditionally we're only able to take them out using liposuction procedure. But now a new groundbreaking technology was developed in America a couple of years ago, which found that when we freeze the fat using a certain applicators and a specialized machine, those fat cells die, and then body slowly eliminate them over a period of time.
How long?
We're looking at a couple of weeks, so anywhere between 8 to 12 weeks.
Incredible.
So after one treatment, about 30% of the fat deposits are gone. So if you want more improvement, then you can have a second treatment, but it is the only non-surgical option, in my opinion, that actually works.
Really?
Yeah.
And so the term frozen.
Yeah, so the term
Got new
frozen.
meaning.
Yeah, absolutely. It's literally freezing the fat. Absolutely.
So a lady walks in a room, her husband says, "You look gorgeous." She says, "I'm frozen."
You can say that, yeah.
Okay. And tell us about the Mona Lisa treatment. What does it do for people, for viewers that don't know?
Yeah, so lasers, dermatological lasers, fractional lasers have been around for skin rejuvenation, especially around the face, neck, hands.
Yes.
But there was nothing for female when it comes to the vaginal rejuvenation, especially with women going through menopause or women going through chemotherapy, radiotherapy, even younger age groups. So the associated symptoms of dryness. This company in Italy, they developed this technology, the Mona Lisa Touch, which is basically a procedure in which a fractionated CO2 laser device is used to rejuvenate the vaginal canal and the area outside. It's a 10 to 15 minute procedure, very, very tolerable, and what we find is that it's the only non-surgical and non-medical way to improve things down there.
Incredible. Downtime?
Look, if it's the internal vaginal canal, then there's no downtime, except that you don't have to do a couple of things for a few days afterward.
No Mona Lisa treatment for men?
Unfortunately not.
Okay, we're ahead. What have been most interesting and challenging cases that you had completed?
There are certain patients or procedures that we do not as a routine, but every now and then. Usually those involves transforming someone's face or body. It's the sort of thing where I would like to mention, like say like a burns victim who has got severe burns and tissue loss, to then improve them to make them look the way or as close to as they were before the burns is something that is always very challenging.
Yes.
Those are the ones that we find challenging and interesting.
And that was the famous case of?
Yeah, so Dana Vulin, she's a very good friend of mine now. She was one of the cases that I worked with. It was a horrendous case of third-degree burns to, I think, almost 70 to 80% of her body. But I was one of the doctors who worked with her during her recovery. Most of the work was done in the hospital by plastic and burn surgeons. Yes. Where I was involved, it was more to do with skin rejuvenation and making her skin as good as possible using the fractionated
Fantastic.
lasers.
There was another case of transgender.
I have done a couple of cases where we soften the masculine features by doing say facial fat grafting or softening up the facial lines and wrinkles, skin resurfacing, and then referring them on for hair removal and things like that, just to basically improve the way they look.
There are so many celebrities today that obviously spoke openly about having had cosmetic surgeries. Caitlyn Jenner, Sophie Monk, Cameron Diaz, legendary John Rivers. Do you think that celebrity endorsement will encourage people of today to make their own decision to have something done?
Absolutely. Look, media and celebrities have always influenced people. Shows like Kim Kardashian shows and other things are encouraging people, rightly or wrongly, to undertake cosmetic medical procedures.
So the message is not everyone can look like Kim Kardashian.
Yeah, and that not everyone has to look like Kim Kardashian.
That's right. And that takes me to another question. The statistics say that 25% of girls between 15 and 17 years of age are considering and thinking of having cosmetic treatments, cosmetic surgery. What's your take on it as a doctor?
In my personal opinion, teenagers, unless they have got a deformity like bat ears or some other gross physical abnormality which is making them suffer at school or get bullied, they should not be undertaking any cosmetic procedures until they are well into their 20s. And because once I find that even when someone gets a tattoo, a small tattoo when they are 15 or 16, they regret it later on.
Yeah.
So just imagine having a surgical procedure when you're that young, which then you have to live for the rest of your life.
Wow. Absolutely.
So I don't agree with that.
Well, cosmetic treatments are not only for women. Is the amount of male patients increasing? And if so, what are the most favorite treatments for men?
We are finding that more and more men are inclining for treatments. I suppose the most common treatment that we see for men from medical point of view are anti-wrinkle injections.
What kind of injection?
Anti-wrinkle injections.
Anti-wrinkle,
You can't say the name in Australia.
Yeah.
In everywhere else in the world you can say the name, but in Australia you can't. So we call them anti-wrinkle injections.
Okay.
Dermal fillers, laser hair removal, tattoo removal are very, very common. In our practice here, we often also do gynecomastia procedure.
What's that?
It's a procedure where men with enlarged breast glands. And
I was worried you're going to say something else. Okay.
Yeah, it's not just the females who have breast glands. Men can also have them. In most men, they're in rudimentary form, they never develop. But in some men with genetic predisposition or the use of anabolic steroids, those glands become enlarged. And then
so they look like they have boobs.
They have like what they call man boobs or gynecomastia. Yeah. So that is a procedure that we quite routinely perform here because no matter how much exercise they do, no matter how much weight they lose, those glands are still there, and because they are not as such fat, they are fibrous connective tissue, they can only be removed by excising them.
And it can be done for young men or mature men, doesn't matter?
Absolutely, yeah. So typically men in their 20s on one side, and then men in their 40s and 50s on the other side.
Wonderful. Now, you mentioned once that you were thinking of calling your business Royal Cosmetic Flying Doctors.
Yeah. Look, that was just an idea. I have trained in Alice Springs Hospital as a junior doctor, and when I was there, we were involved with Royal Flying Doctor Service, which, as you know, is very famous for sending doctors for retrieving patients and providing medical facilities to rule out emergencies. So when I got into cosmetic medicine, and we were one day, a couple of doctor friends, we were sitting having a drink, we decided that we should create our own little branch of flying doctors and call it Royal Flying Cosmetic Doctors.
Emergency anti-wrinkle, emergency Mona Lisa.
Absolutely. Yeah, you'll be surprised at how in rural towns when I visit, my patients who are having their anti-wrinkle treatment, they wait for me patiently.
At the airport already?
Not at the airport, but I do get text messages and emails from them.
Fantastic.
When are you coming next? Our anti-wrinkle injection treatments are running out. We need the top-up. So it does work like that. You'll be surprised that there are people who need an emergency cosmetic procedure.
Yeah, I want a doctor. Yes?
Yeah, absolutely.
Yeah, I want a doctor. So is there a difference in between working in rural areas and urban areas?
Yeah, absolutely. Most Australian rural towns are underserviced when it comes to facilities and services. Not just cosmetic medicine as such, but in general medicine and everything else, as we know. So people in rural towns are very appreciative when a specialist or a doctor who is offering a certain procedure visits them. They're very humble, they're very welcoming. And they just really, really are grateful that we visit those towns.
Absolutely. Now, there are growing amounts of adverts trying to attract people to go to exotic locations and have a cut price treatments. What's your take on it?
A lot of people in Australia are choosing to go overseas for those procedures because they perceive that the surgical treatments or treatments in Australia are very expensive. Yeah. That's what the perception is.
So it's money factor. Yeah.
So yeah, so
how
there
is
are multiple
the safety factor? How is the safety factor in it?
The safety factor is that we do know that most of the procedures carried out overseas, if they are carried out at reputable hospitals with reputable surgeons, they're fine.
Yes.
However, we never know when a complication may arise. And if you have had a surgery, say in Bangkok, and you're sitting over here, then what sort of follow-up you have? So that is the thing. It's just like buying anything without a warranty.
That's right.
So that's where I stand.
That's right. Now, what do you think? How do you make people feel, apart from obviously changing the way they look, helping them to change their look? How do you help them when they walk out of here? Sure.
Look, there's often a psychological component to having a major anti-aging procedure done. I personally think that every person is beautiful in their own way. Not just the physical side of things, but the personality, how you speak, how you carry yourself, your self-confidence. Those are the things that make you attractive, not just the physical beauty of things. This is something that you should only be doing if you can afford it, and if it is going to make a difference in your self-confidence, self-esteem, and things like that. Or if you want to stay in the workforce, things like that. Often middle-aged people who have just recently separated, and there are a lot of them in Australia, they lack the confidence to go out and put themselves out and meet other people. So those are the people that I think, they will benefit from a minimally invasive procedure that we may offer, that just to give them a psychological boost.
What can we expect from cosmetic surgery world in the near future?
Sure. The trend at the moment, as we are seeing it evolving, is that things are moving away from hospitalized, overnight stay, general anesthesia to minimally invasive procedures. Patient walk in, walk out, they have a surgery or procedure within a few hours, and then they go home. And the recovery is quick.
And research, new treatments, new...
there are a couple of promising procedures that are soon to be becoming more popular. They're just in their trial phases still, like stem cell therapy, for example. We've been hearing about it for the last few years, but it still hasn't really cracked into
and that's anti-aging, correct?
Anti-aging, yeah.
Lovely. Ehsan, thank you so much. I know you have plenty cases to go to now.
Thanks so much.
And thank you for your time on Hello Darling.
Thank you. Thanks for coming to the clinic and giving me the opportunity to share my thoughts with you.
Lovely. We're looking forward to flying cosmetic doctors.
Absolutely. It's coming soon.
Thank you. Thank you very much.
Thank you.